it's
32-week twins.
Good.
Yeah, a couple days.
I call the meeting of the Board of Health of January 10th to order. The first item on the agenda under new business is the acceptance of the minutes of the December 6th meeting of the Board of Health. Do we have that motion?
Motion to accept.
Second.
Thank you. The next item on the agenda is the Tobacco Control Monthly Report submitted by Cesar, Program Director. Cesar?
Yes, as you saw in my report, we have a tobacco permit suspension hearing tonight. We did a compliance check on November 16th, a Thursday, in the afternoon. We checked 28 stores in Lowell. Only Ramo's package store sold a pack of cigarettes to that 16-year-old female. You see a photograph in front of you there. This is a pack of cigarettes that we purchased there. This is a Marlboro Gold for $13.75. The sale occurred at $3.39. Like I said, I mean, the compliance check was going really well. We had checked 27 stores, and then the 28th made a sale to the minor.
No, that's fine.
So this is a first violation within the last 36 months. Pursuant to the state law, they could have a permit suspended for up to 30 days. Your local regulation was amended to say that a first offense would be a 3-day suspension, 3 consecutive day suspension. So that is my recommendation. Ms. Yogendra Patel is here tonight. I'm sure you'd like to address the board.
Ms. Patel?
Yes.
Yes,
Yeah.
please.
Thank you.
Please state your name and
Address.
Yes, this is Yogendra Kumar Patel. I'm in 77 Branch Street in the Ramos Package Store.
Did you have anything you wanted to say about the violation?
No,
No. Okay. All right, thank you.
you were.
I recommend that the suspension begin, the 3-day suspension begin the 24th of this month. It's a Wednesday, 2 weeks from now.
Make the motion.
that's from the open of business.
Yes. To the close of business on the.
We need, first we need a vote on the 3-day suspension.
I'll make that motion.
Do we have a second? All those in favor?
Aye.
Roll call?
Joanne?
Yes.
Bill?
Yes.
Erin? Yes. All in favor?
We're going to resume compliance checks this month, probably.
Thank you.
this Friday.
Thank you.
Did you want to just,
Yeah, so just, you're going to receive a certified letter, basically, with instructions, which primarily entails of you removing all tobacco products before the time the suspension is started. So look out for that suspension letter in the mail, okay? Certified mail. So this compliance check was conducted in November. We didn't do any compliance checks in December, so we're going to do now in January, most likely this Friday. And as far as the permit renewals, you saw in my report that there were a couple of stores that had not renewed that permit. They have since renewed that permit, it's $70. It's been an ongoing problem for years. Every year is the same thing. We're the last ones. We were the last ones last year, they're the last ones this year. I have to be honest with you, there are times when I think of actually suggesting they don't renew that permit because they don't care. The company has a protocol where the corporate office does the renewal, the licensing, and so the managers don't read the application. They don't see all the policy points, the 16 policy points on the back of the application. So they don't know when the permits expire. They don't want to know when the permits expire, and that is the reason. One of the reasons why, when you amended the regulation recently, I asked that we interact primarily with local management so they can be more in the fold, because they are the gateway to possible violations. So this morning I had a conversation with 7-Eleven, and we received 4 applications from 7-Eleven yesterday. They all had already been renewed by the local managers because I send the renewal to them and I keep calling them. All of these applications they were wrong, each one of them. Several things wrong with them, like applications were not signed, some had the wrong application, the addresses were wrong, all kinds of stuff. So Family Dollar continues to be like perhaps the worst of these larger companies that have a problem renewing permits on time. And it's not just in Lowell, they have stores in Lawrence, it's the same situation. So the district manager, I've spoken to him for years, and he does the best he can. This is not like a local matter, a local problem, this is like a company problem. They say, no, we at the corporate office, we do the processing of these applications. You shouldn't be concerned with that. I think that's a problem, and that's why we had the regulation changed. Still, he wasn't able to get the corporate office to send them the checks in a timely fashion. What these local 7-Eleven establishments do, they just like, they buy a money order, and they pay with the money order. They don't wait for the corporate office because they're late. So, like I said, we got 4 checks just yesterday. Thank God these local managers had already renewed these permits, and they did not incur any possible chance of a violation. But that could have been the case had they not applied locally. So we keep on monitoring Family Dollar, see if that's going to change, but I have my doubts.
So, Susan, I guess the question, so we had talked about making the local managers responsible. Do we actually make that change?
Yes, we did make that change. It's still a problem with Family Dollar because no matter how much they may want to do this locally, the company won't let them.
Right. And at the end of the day, if they violate it, the fine goes to the local entity, not the company, right? Or the company will hold the local entity responsible.
Well, Family Dollar, they own both stores, so they're not franchises.
Oh, they're not. They're actually owned by the company. Got it.
Right.
Okay. Right.
But even if the local managers want to do it locally, they say, no, we're going to do it from here, and that's a problem. So we'll see how that goes next year. Thank you very much.
Thank you.
Thank you.
The next item on the agenda is the Pride Star reports as mailed. Any questions on the Pride Star report? Oh, I'm sorry. I skipped the, skipped the Development Services report. Monthly Development Services report submitted by Senior Sanitary Code Inspector Jimmy Lee.
Good evening, Board.
Good evening.
So, aside from the routine inspections we do every month, last meeting, we have the schools, DPW, Airmark, call them here. The board had asked me to join their meetings, in which I have every Tuesday. And pretty much at those meetings, we were trying to figure out who's responsible for what and kind of get a clearer picture as to why we are facing these, shortcomings. Essentially, you've got 3 entities. You got DPW, who's going to be responsible for equipment not pertaining to food service. So things like ceiling tiles, the doors, and general maintenance like that, floors and stuff. You have Airmark, who's then responsible for the equipment itself, like steam tables, ovens, and the hoods. And then the school department for things like not posting a serve safe or not getting the choke saver, things like that. So in this meeting that we were going to, it's primarily the DPW that is at this meeting, so Underwood and Paul St. Cyr and stuff like that. So at that meeting, they did tell me that Airmark is responsible for the hoods, the Ansel system, and the fire extinguishers inside of the kitchen. They have a separate thing for the rest of the school, but DPW does have the permission to use the Airmark account and to schedule that Ansel inspection on their behalf. So at the end of the day, DPW is responsible for that, even though it's Airmark who's supposed to be scheduling their hood cleanings and things like that. I was told, things would be done the first meeting, and then great, Wednesday morning we go out and we do some inspections, and we're still finding things aren't done. So then the following week, Tuesday, I go, what's going on? And then they go, there's always something, So I think at this point, there are just pretty small things that they may still be working on. I know last week's meeting, there were maybe 3 line items, things like cleaning out the heating register, painting that, pest control reports, ceiling tiles, things like that. They told me it would be done, so we have not gone out to take a look at that yet because, you know, heard it before pretty much. And I'm just trying to give them the benefit of the doubt so that when my inspectors go out, we're not doing it, you know. And so many times, there's some schools we've gone 5, 6 times, and it's just, you know, I don't want to play those games pretty much. So
But at some point, you're going back out.
yeah, absolutely, you know. But, you know, I'm just kind of sick of being told it's all set just to find out it's not, you know.
For the Bailey School one, when Airmark was here, they said that they put all their ServSafe certs in a binder. Like, have they fixed that? Because it says no ServSafe.
Yeah, I mean,
So they just
Yeah.
didn't, they still have it in a binder somewhere,
that's,
maybe?
you know, they'll tell me one thing in an email and you go there and it doesn't happen, you know. And that, you know, there may be some disconnect in communication when it comes down to who runs the kitchen. You know, we have a lot of people here kind of working in the same place, so there's a lot of miscommunication.
But just so we're clear, the school department hires Aramark. They're a contractor. The school department is responsible for making sure that they do their job, their contractor, right? I mean, the Board of Health is not going to say to Aramark, you're not meeting your contract obligations. It's the school department and the city that has to say to Aramark, you know, you need to follow the health code. So, you know, I mean, it's not up to DPW to make sure that they get their hoods inspected, right? I mean, that's
I mean,
Aramark's, it seems to me that that's Aramark's.
I'm just the inspector here.
Yeah. Yeah,
I'm just
yeah.
doing it, so
But you are correct.
And-
with the way I've been doing, I don't know, like, what the pecking order is over there and how their contracts are written.
Yeah.
All I know is these are the deficiencies. and
Right.
I send it out.
Right.
I'm sending
Right.
it to everybody. So
Right, and your job is to report, you know, the failure in them following the health code. It's not, like you said, to get in between whose job is it, but, I mean, technically, Aramac is a contractor of the city and the school department. So, you know,
So,
part-
but so as a board, we can make a statement to the school council or school committee that their contractor is not, I don't really want to be heard. This board could make a statement, as we have done in the past, to the school committee, that their contractor is not upholding the codes of, the health codes in the city, and they need to do something to hold them responsible. So we can make that recommendation if they're that, continue to be that deficient. And that's all really we can do.
so you'll continue to go to those meetings?
until everything's done, and, you know, I
So,
mean,
yeah, I think on a separate agenda item, we can talk about the Pawtucket Memorial School,
but
but what you're saying is the other schools that were on the failed list before and the current ones, pretty much everything has been resolved,
We've been told.
so
or you've been told that.
at the last meeting, you know, I brought to them the list, the list I'd had maybe two weeks ago of the outstanding 10 schools, and of the 10, they already knocked off anything that having to do with Ansel and fire because they knew that wasn't done yet. So I said, okay, there are three or four that don't have that as a violation. I was like, then we'll go take a look at those, which they said should be all set. They were not all set, and so I'm just week to week going back there and saying, like, what's going on here?
Okay.
They are taking, you know, some steps forward. You know, they want to figure out this whole impact fire contract because they're the ones who do the fire extinguisher, the Ansel inspection, and the hood cleaning. It's all routine scheduled maintenance. There shouldn't be any chasing around to do it. You know, in the summertime, typically, ASAP would just do everything. But because Impact bought over the company, there's a little confusion. Hopefully, once we get through this whole round, everything can now be back on track. And that's our hope. But there's going to be little things like the technician they send out will miss a fire extinguisher. They didn't tag or test that one. And when we go, we're gonna find that one, and then, it's yeah. I mean, and we go there, and it's not, we're not there to like pick anything. Like,
Yeah, but this isn't new, like, the health code isn't new. It's not, it shouldn't be new to Aramac, what the standard is. I mean,
right.
and these people aren't new to the game. It just is a little frustrating, but I think it's helpful that you're there and you hear that they're trying to figure out whose responsibility what is. I'm not sure why that's new, but it's early. And but we can hope that.
Well, I mean, is it unreasonable to say by next?
So there's a plan, I think, so on the agenda, we have a report on the Pawtucket Memorial School, and there are issues there that are going to be discussed, and so I think the plan would be that next month we would invite again the DPW commissioner and Mr. Underwood from the school department to talk about where they've come in terms of all the violations, or not violations, but the report on the Pawtucket Memorial.
Well, I would, first of all, just before we move on to that, I would want you to re-inspect all those schools
Yeah,
for the next one and see
absolutely, yeah.
what has been done that they said they did and what has not been, so we have an updated report, that's all.
Okay, so,
And then Pawtucket, you can talk about separately, like you
yeah,
said.
so that we can, they'll be here next month, hopefully.
Right.
And you can update us on where they are in those schools that were they were discussed in December, but they were violations from October, November, and
Yeah, I
whatnot.
mean, they've been ongoing for
Months,
long
so
time.
we can see where they're at.
And then during the last Lowell High kitchen inspection, we discovered a whole other kitchen that we didn't know existed.
A hole? A hole?
It's a whole other kitchen
Oh, a whole nother kitchen.
that serves this whole other purpose. It's a brand new kitchen. It's a nice kitchen. It's a part of the whole new construction.
Yeah,
We just happened to stumble upon it. It's called Murphy's Kitchen or something like that. And
okay.
so we went in there, took a look at it too, and
And they're
there are
functioning?
deficiencies in there.
They're using the new kitchen, the newly constructed kitchen?
Yeah.
Oh.
They're using it, yeah.
Didn't know that.
At the high school?
Yeah,
Yeah, so the old one's completely demoed. It's gone. It's been
Okay.
gone for a little while. The new kitchen, yeah, they've been using it ever since they opened, but there's like this transition plan. So the current kitchen will be expanded eventually, but they're phasing it in. Some, I don't know. They currently have like a freezer outside, so people got to go outside to get something from the freezer and go back inside. And eventually that's going to be moved inside. I don't know.
So then there's still a separate Murphy's Kitchen in addition to that.
Right. So then they have main cafeteria, they got Murphy's Kitchen, and they have the courtyard restaurant.
so you had never seen Murphy's before.
Until the last inspection. So, but it'll be on our list now.
Okay. Interesting.
Okay.
Any questions?
No.
So is there any plan, there was, I think, discussion last month that you talked about a shared spreadsheet?
Yeah. So that's the idea, is for them to set that up and include us in it. It's pretty much, we need to see the fire reports, because the school does it and manages all that on their own. Myself and the building inspector, when we go do our inspections, it's just kind of a mess to go and ask for the paperwork and this and that, and it's may not be in the right place, whatever. It's just easier if we know it on a shared, Excel sheet or something, what's done and whatever. So I don't think that's been created yet. It's in the works.
Okay.
But the idea is just to have just that transparency between everybody.
Okay. All right, thank you very much.
Thank you.
Thank you.
Keep the faith. Okay, the next item on the agenda is the Pride Star report submitted by John Kelly. Any questions on the reports that were mailed?
Nope,
Okay.
just the numbers are creeping.
Yeah, they are. Okay.
Madam Chair, I do have a question about their accident report. And I'm just wondering, is that all the information that we typically need when they are involved in an accident? Just no injuries, traveling 90 miles an hour? I mean, I'm okay with it, I just didn't know, was there some minimum amount of information?
I believe that this is all that we need from them, and they will report it out when they come. They'll give us more information next month when they come.
Got it.
Yeah,
Great, thanks.
okay.
Okay, thank you. The next item on the agenda is approval of the body art practitioner licenses.
Make that motion?
Second?
Do we need a roll
Yeah.
call?
Joanne?
Yes.
Bill?
Yes.
Erin? Yes. Allison and Kathleen are absent.
Okay, and the mosquito control project is just a piece of information regarding the dates of their meetings. The next item is the report of indoor air quality on their assessment of Pawtucket Memorial Elementary School.
Yes. Too heavy.
The first piece is the EMSL analytic report, also called the mold report, I guess. And then the other piece of that is the indoor air quality report. I guess we could discuss both of those. So obviously, this is a very detailed report. Reading this, obviously, there's concerns by the board has concerns, I have concerns. I'll let the other members speak for themselves. There's a lot of recommendations. There's some short-term recommendations, a lot of short-term recommendations, and some long-term recommendations. I did have a conversation with the health director after receiving this report. I'm sorry, the director of HHS. I did call you the health director. But you're so much more than that. We talked about the concerns. Some of the short-term recommendations have been completed already, but there is much more work to do. And the commissioner, the DPW commissioner, is available to be invited to our next meeting it's a little too early to get a report on where they're at for this meeting, but by February, I think we could expect him or his designee to come to the meeting and let us know where they're at. And the board can jump in whenever they
Oh, you're doing great.
feel necessary. There's concerns about the HVAC system. I think there's a plan to replace the roof. So there's some major long-term issues that I think are going to be addressed. I was unaware until I read this that the cyber attack affected the HVAC systems. So there was some DPH, I have to say, as a DPH person, always does a very good job in their detailed review of the systems, both the building interior and exterior. It seems like there are some things that could be easy fixes. Like,
A lot of the short-term stuff is easy fixes, and I think they should come back next month and let us know which ones they've done, which ones they have not. And obviously, fixing the HVAC system might take more,
right,
but a lot of this other stuff should be done and should be done very quickly, and I think we should expect them to do it.
cleaning vents and putting weather stripping on outside doors and things that, you know, are certainly,
Right, even some of these, right, even some of the long-term ones, like remove the bird's nest, put a wire mesh so they don't go back in it, like, somebody needs to start doing these things, we need to see improvement. in the
so just for
short
the record, there are 48 short-term recommendations. You know,
Right, hire a handyman who'll get 42 of them done in a day, right? I mean, very little of this is heavy lifting, or requires a lot of money, it just requires somebody to actually do it.
The missing drain pipe was how do we just have a missing drain pipe hanging out?
It's
Yeah.
the water flow.
Nobody saw it.
yeah. So actually, there's 10 ventilation recommendations, many more water damage recommendations, and some long-term recommendations, the roof and the HVAC system, basically. And carpeting, why they ever still put carpeting or allow carpeting in a school is beyond me, but always issues with carpeting. And I can remember years ago us touring the freshman academy with then Commissioner Clancy and Mr. Underwood, and there were a number of chairs that had the tennis balls on them, and we talked about latex then. And I think that was probably 8 years ago, I'm guessing. But the fact that, you know, there's an issue with tennis balls on chairs and latex and et cetera, and the breaking down of the tennis ball and the materials that can be, you know, concerning. So, I don't know, I guess nobody got the memo about that. So some of these things we've been through, we've toured, we've noted, we've talked about, it gets a little concerning, frustrating to be still talking about that vents and cleaning vents and temperature control
So, yeah, so we asked them to come talk.
So we'll give them some time, we'll ask them to come to the February meeting, and hopefully they have a team out there that's working on these things. Anything else anyone wants to say about it?
Nope.
Okay. Ms. Ortiz, did you want to speak on the matter?
Yeah, I did want to speak on a few other ones, but am I, like, I can't speak on the other ones, just, you want me to focus just on this one? I just want to be clear. Sometimes I have a
well, I
little
didn't-
difficulty processing.
Okay, so if you want to come up and state your
Okay.
name and address, and you can speak on the current agenda item first, it'll be good.
Sure. Okay, Laura Ortiz, City of Lowell resident. So Corey Holmes, they did a phenomenal job. Thank you so much for allowing them to come into Lowell Public Schools and willing to take this report. They pointed out the line that said that, that these should serve as best practices that apply to most public school buildings across the Commonwealth and should be shared amongst other buildings in the Lowell School District. So I wanted to know if the board would consider basically adopting this report as best practices that can be shared and done in all of the other public school districts. I think that would send a message of solidarity with the minority community in a lot of these schools and the issues that they face, and maybe get more of a cohesive, or whoever you call the public health practice with getting all the schools kind of on the same page, but, you know, with the understanding that BEH could not come into all the schools. We're appreciative that they came into the worst. But it doesn't mean that at any given time that one of the other schools might have the problem. You know, we saw Lowell High, you know, throughout the years have issues just as bad. And it seems to be a recurring issue, especially based on the public records that we pulled from indoor air quality from years ago that the city law office has. So it's just kind of a, you know, a question. Is it within the board's jurisdiction to take this report and say that, you know, this is the best practices that we want for all of the 26, you know, or however many schools are in the district?
So just to clarify something you said about, thank you for allowing the DPH to come into the Pawtucket Memorial. So the director of HHS and Dr. Hall from the school department actually invited them to come in, called and asked them to come to the Pawtucket Memorial. So it was proactive on the part of the health director and Dr. Hall to invite them to the Pawtucket Memorial.
Yeah, I think it was at the subsequent time, me and a bunch of people behind me, we had already sent a request to Indoor Air Quality asking that they also come in, which I believe was preemptive prior to your request. I'm not, you know, we don't have access to all the
Yes.
records, so I was just thanking you for being so proactive this time and getting them in there. I mean, I don't
And
know
the
how to.
board has
Yeah.
requested, I know the board in the past has requested indoor air quality to go to the high school. They've been there a number of times. And so DPH is happy to go to schools that we ask them to go to. I mean, you sort of first have to show that there are, you know, this is why we'd like you to come out. We obviously had good reason to ask them to go to the Pawtucket Memorial. I'm not sure what you're saying about adopting, I mean,
do.
I don't know how to say it better. Yeah, I mean,
So,
these are best practices.
let me be clear to you, and I'll say personally, this is just personally me, not the board. When we went through this whole thing with the high school, my expectation was that's exactly what happened, that the school committee and the school department would take all the things that we learned and we insisted upon for the high school and make sure that every other school was having it done to them and following the same loans. So, to your point, there are best practices in how to maintain a school, and that's a lot of what's included in here. And yes, the expectation is this board expects the school department, I expect the school department to go through every school and do it at every single school. So then we're not back here in 2 years with another school having the exact same problems. I believe that that's what you're trying to say. Adopt these practices, make sure every school has excellent air quality by adopting the things that are standard things that they should be doing already. And don't come back here in 2 years because you fixed one school but did nothing at the other schools.
I do, yeah. Corey Holmes, you know, we went back and forth a lot, and he gave tremendous credit to, and I'm so sorry if I said it wrong, Director Gold, is it of HHS and the Board of Health, or the Board of Health Department? I apologize if I didn't correctly, you know, give your title. But he gave a lot of accreditation to Ms. Golden and the willingness, and I believe it was with you other board members to kind of listen to the Bureau of Environmental Health, take in what they said, maybe get some extra training, and be receptive. You know, I'm sure the state has gone into other districts that, you know, or cities or towns that were not receptive and said, you know, get out of here. You know, you can come in and look, and we don't want to listen to you. So I do give credit to the board, and to bring back Dr. Galvin's point, is it possible, I don't want to say issue a letter, but just somehow adopt these recommendations? I know the Public Health Commission of Boston has almost all of these recommendations already as a practice. I know I spoke about that back at the high school, you know, with some of their ordinances are a little bit different than Lowell. But it's just something that, you know, if we know what would work as best practices, how can we achieve that as the practices that the district is going to use and carrying on to your health inspector where, you know, you've got the spreadsheet and these practices are implemented to kind of knock off the spreadsheet for the school dude work orders or any of the roof leaks or maintenance issues with the HVAC or any other issue that's contributing to the indoor air quality.
For example, Madam Chair, no more tennis balls under chairs, like that, why is the next school gonna have it? We already banned it at one, right? So it's those kinds of things that we could be adopting, the blocking of vents, and the letting birds grow in the vents. I mean, there's just things that are just, need
Right.
to stop. So we agree with that. I agree with that anyway, as a board member. I agree with that.
So
So-
we could,
Can I just, so that would be something on the school side for the Health and Wellness Committee to do? So that's something that under DESI, the school side should have a Health and Wellness Committee. So that's something that should be done by that
But this
committee.
board can say to them.
Correct.
We are expecting you to take these
Correct.
recommendations and adopt best practices across the
Correct.
entire school system, and
Correct.
we'd like to see. it.
And that's something as a whole from the Health and Wellness Committee that they should put into practice into all the schools.
so,
I
do
don't
we
know
have,
if it's better, or sorry.
I'm sorry, so do we have a motion to recommend to the Health and Wellness Committee of the Lowell School Department that they review this report and consider incorporating it into their, consider accepting it as?
What is it? Is a standard,
So I would say some standard recommendations. So some of them would be like the tennis balls under the chairs. One of them would be like air fresheners in the classrooms, the scented air fresheners,
whatever, yeah.
purifiers, like things like that have, I believe there's a part in there that Corey put in there that would make anything for children that are asthmatic. So we could come up and, I believe that the secretary and I could come up with a few things and maybe bring it to the next meeting for things that would set off children who are sensitive, who have asthma, and then children with, who have latex allergies. So we'll pull those out of the report. And then I know that the council's working on the HVAC systems, but things to keep the HVAC systems up. And then once the HVAC systems are up and running, to keep them maintained going forward.
Okay.
Does that,
Yeah, so we would, yeah, so you, whether it's you or the school committee, whatever the committee.
well, maybe the health department in
We can help
conjunction
them-
with the.
help them with it, right.
yeah.
But yes, we would
Health
love to
and
have
wellness.
some best practices adopted across the whole school district.
Okay.
How's that?
Well,
Thank you.
we were given, and I'm not trying to say this with disrespect, just based on the records alone, given the historical history, I know that Director Singleton, dealt with this issue in multiple schools, especially the Pawtucket Memorial. Is there any way, I don't know if the quite word is stronger, but like a very clear directive to adopt all of the Bureau of Environmental Health best practices, like they're suggesting across the 26 schools with the BEH language? Because the only thing that I fear is picking and choosing, we're going to still end up with certain problems in certain schools. And so in order to
I don't know
address
what
it-
you mean by picking and choosing in certain schools. We
Maybe I
just-
misunderstood. Yeah, I thought you were going to pick just certain things out.
There might be certain things that just aren't necessarily doable for us as a city. So it would be blanket across all schools, but every school would have the same things that they're expected to follow. It's just that we may not be able to adopt all 27 or whatever there are. We might be only adopt 25 of them because for practical reasons. And if they come back and don't, they should be able to tell us why they can't do it.
So for instance,
Right.
rugs in a classroom are bad, but we can't go tear up all the rugs in every school and every building in the city. We couldn't do it at the high school. We set up a plan at the high school where they did a certain number of rugs every year, and because the building was going to be torn down, it wasn't economically appropriate to do new flooring when the building was going to be renovated. So, yeah, we could set up some standards, but there's not every recommendation in here. I don't think it would be realistic to say that they have to follow every, goal, every standard that can be followed. I mean,
Yes, we can ask that.
there are some things that they made a recommendation that the rugs should be taken up before the summer, and they made some recommendations around that. That was just an example I was using, but yes, I think that we can pull out all the health and wellness recommendations that are important, that all the schools in the city should follow, and we can send it to the Health and Wellness Committee of the school department and say, these are things that need to be adopted. Will you consider this?
Would you consider, the school dude, I think is, one of the better ones that I've seen in so many different districts that we pulled records from. Is it possible to get the public appropriate copy of the school dude that doesn't have, that gets redacted? Is it possible to get the, the actual Board of Health on the same page with the school in real time where you all can watch the progress and maybe the public and, just to kind of build some confidence back because I don't.
Nobody on the city side has access to School Dude, I believe, except for DPW. So that's not anything that I have access to, so I don't believe that's anything that the Board of Health would have access to.
No, I thought it
so.
was the gentleman, was it Jimmy? I thought he said that he was asking about that spreadsheet.
No, I think he's going to have access to what they were talking about, the dashboard or an Excel or Google spreadsheet between him and DPW. I don't think he's going to have access to their work orders or their complaints.
Okay, would the board consider asking for a copy of the school dude every month to just?
No, I don't think that's something that we're going to get into. I run 5 departments. I don't think that's something I'm going to get into.
No,
Well,
no,
we got
I don't see the purpose of it. I think that,
Can we move on to the next agenda item?
Yeah, our scope is not management, our scope is oversight and direction, so let's be on it.
Okay, may I sit down?
Yep,
you all set now?
yep.
All right. Is there anything else you wanted to say about any other agenda? Because we only have one item left, is the director's report and the divisional reports.
Yeah, I did. I think it was on, I think it was, one thing I wanted to, so sorry. Sorry, Yoda. I wanted to commend you on the accreditation part. I thought that was phenomenal because I saw that, who else was up there was Boston Public Health Commission. That was on the, it looked like a slide thing or something for the public health accreditation. I don't know what engine.
Oh, we haven't got to that agenda item yet.
But thank you for the applause.
And was there something you wanted to say about the minutes of the meeting?
Oh, just the first one, it just was missing the extra details when a public speaker spoke, but I wanted at the same time to say that I thought it was great the rest of the meeting did mention, when the public spoke and, briefly what they spoke about. But I wanted to ask a consideration if you thought about, I think it's LTC, I'm thinking, that does do the videos of your meeting. If you consider on every agenda item moving forward, aside from the meeting minute draft, if you consider, and we asked the school to do this too, because sometimes people with disabilities, they, either, they can't really follow along to these brief draft minutes. If you consider adding the link to the prior meeting so that way people can, can see it with video. It's on the what?
City website, the links to the agendas,
It's on the city
the
website?
packets.
You want the link to the video from the previous?
No, the link to the video. I'm talking about
She's
the
saying in
LTC
in-
video.
In the agenda, can you put the link to the last month's video?
I don't
That's
have
what
it
you're
yet.
asking?
Yeah, that's what we asked, and we had asked the school committee about that, for people with disability, people that would, need, with their brain processing, need a little bit more than the agenda item. Would you consider adding the link to the LTC video? That way you've got like a really full description of the meeting. You can hear everything that a speaker said.
A link to the video
To the
on the meeting minutes? Is that what you're asking
Oh,
for?
no, in the agenda. I probably said that backwards, sorry.
So,
Yeah, when you put the draft of the
Carrie.
meeting minutes, and then below it, if you'd consider, as a board, putting an actual link, the LTC link, for example, for this month's agenda for January 10th, when you're talking about, I think it was the December 6th meeting, that you put the link to the December 6th meeting from LTC. It was just a suggestion that I thought would cure any issues with meeting minutes.
If we're in agreement to it, I can show you where it is. I've seen it.
It's not a hard thing to do.
Yeah.
Yeah, you go to ltc.org and you click on play meeting.
Right, so in those minutes, you would just have that link in your agenda for this month, so somebody could just hit the button and go to the.
for last
for
month?
last
I
month's
don't even know if that would
video.
work, Bill. I
It
mean,
does
it's
work,
a-
it's just like clicking on this to go to the PDFs, it's the same idea, you can do it. I'll let the boss show you how to do it, that's fine.
Okay, thank you for the
So we'll look
suggestion.
into, we can look into that.
Anything else? I'm afraid you've gone way beyond your 5, 10, 15
I know,
minutes.
there were so many things. For the public health accreditation, I wanted to know with joining something like that for 2 issues, and it was on the Trinity report, given the Lowell's numbers, they're so horrific. when you join the public health accreditation, and join with all those other cities, is that gonna give you like better access to their Board of Health, maybe suggestions that, from some of the larger cities throughout our country, how they deal with some of these crises, how they might be able to get the numbers down? Because I don't think, based on some of the numbers, I was very surprised because Lowell numbers were so much higher than some of the other cities I thought would be similarly high. Is this gonna help with, I don't want to say coordinating, but giving you a little bit more education or some of the best practices even from out of state Board of Health, so will kind of help you combat this unique issue that I'm going to guess that other cities I know, maybe in the heart, of the country, maybe on the West Coast, that also deal with opiate issues, and certain cities that just have higher numbers than what they may have used. And because you don't like when
Are
I
you
go into
talking
the-
about opiate numbers or communicable disease numbers? I'm confused.
Opiate numbers, yeah, there was a few things I wanted to say, brief things on, for the opiate numbers, for, combating the crisis. I just called opiate for any overdose, I should call it overdose, because at
So
this
those-
point, it's not
Those
just
numbers are
overdose.
just Trinity. So like, there's other ambulance companies that are not necessarily reflected in that report. So I know you mentioned like the different cities, so they might have other numbers, but they're not
Oh, okay.
reflected.
So you think that our numbers are higher than other gateway cities?
No, you know what? Part of the problem is Trinity's phenomenal with the data. I think they're one of the best throughout the state. I think part of the problem is when we process the data, when we're looking at something, I thought, oh, well, this is weird, the numbers seem down. You just explained to me that that's not necessarily true because that's one ambulance company, but I didn't think of it. I honestly thought Trinity was pulling everyone's data, like Patriot, Trinity, anyone's. So I assume the reports that you get are like citywide.
No. And I'll also just tell you that hospitals, I won't speak for our health director, or whatever your official title is now, but there is lots of conversation across the nation about opiates. If any one city had figured out how to drastically reduce their opiate overdoses, we would all be imitating it. People look here as much as they look elsewhere to figure out what we're doing to try and work on it. There is nobody that's doing a better job at it or has best practices that they are doing that we have not tried to adopt here or not already doing here. I mean, if you can find one, show it to us, show it to me, and we can make sure that we do that. But you're not gonna find a city that legitimately is doing something that much better than what we're doing here. So if there are less opiates, there's probably less opiate usage, often tied to socioeconomic issues, gateway, things like that. There's other things, but it's not necessarily what we as a city do to make a dramatic difference. I haven't seen anything that dramatically reduces it, other than decreasing poverty. That's it. But we're open to hearing about it if you find a place that is doing something dramatically different.
Yeah, that was gonna bring me to the second point. For some of the areas that you're in, I was, like, my mouth dropped, the needle counts were so high.
That what's so high?
Our needle
Counts
counts?
so high, just the picking up in the area, I think it was 12,000, I think was one of the total counts. Has the city reconsidered, we had asked them years ago about maybe having those safe boxes or whatever you call them that other cities use, where people can kind of pick up maybe, or assist picking up needles, or maybe have a place to drop off needles? Has the city reconsidered kind of
We
using
have, we
those?
have syringe exchange programs.
No, I know, and we have a great
Safety
community.
boxes to get rid of the needles?
Yeah, the ones that, they're in the park and, I don't know, maybe, I don't want to say homeless, they're just outside and they're not going to come to your great, phenomenal drop-off centers. They're the ones that are going to go like that and drop it on the ground. Have you considered putting up any needle
I thought
safe?
we had them.
Oh, we did too. We had them at one point, didn't we?
They were before, but people want, there had been studies in the past that the people who use would like to exchange the needles for new needles. So that had been, when studies have been done by Tufts University and different people, done by people who use drugs, they would like to exchange the needles versus picking up needles and putting them into a box. And I would not like just regular people to pick up needles and put them into a box who are not vaccinated against things and who do not have bloodborne pathogen training to pick up things. I would prefer it to be the people who are the syringe coordinators who are trained to pick up things.
Yeah.
Yeah, I was thinking in terms of just, giving them, whoever might use this, a way to get them actually off the ground, because I know the city does a phenomenal job
Right.
on needle pickup. I mean, I think you're one of the best in the city.
Yes, Andres is
But you
fabulous.
can't, you're not going to be there for every needle, so if we if
Well, I
in
think
the
what the,
highest
I'm sorry,
profit-
what the director is saying is the people that are using these needles, the drug users are motivated to exchange the needles, but they're not maybe as motivated to pick them up and put them in a box somewhere. So the studies have found
Right.
that to get the people that are using those needles to pick them up, they want an exchange. They're not motivated, they're using drugs, they're not thinking right, maybe,
And the 17,000 that we pick up weren't going to be put in the box anyway? You're saying?
the studies have shown that the motivation is getting an exchange, and that's why there's some needle exchange. And the director's right, we don't want just anyone being encouraged to pick up needles and put them in a box that we would have somewhere. Hence the purpose of having the people that are vaccinated picking them up and securing them and disposing them appropriately. So I think around needles, we're doing a pretty good job in terms of how to get them off the street, out of our parks and whatnot. And did you have anything else?
Yeah, I was going to ask, when you, and again, I think this is incredible for the public health accreditation, if I'm saying this right, is when you do something like this, is this going to open up, given the motivation, especially, because I think you're doing a great job, is this going to open up abilities to get, more licensing area, more, is it going to help with, and not critiquing in any way, the staff that works for the Board of Health, but kind of, help it get to the next level of as much support and education, to keep up with the specific individual issues that our city has that might be a little bit unique, given that we don't have the same ordinance as Boston, we might be a little bit different than Worcester. Is getting this accreditation going to help your Board of Health team and HHS team get to, the next level of, I don't want to say higher education, I'm not really quite sure, but if you could help me out in that, whatever it would be, because I know when Corey Holmes was speaking, he was suggesting and so many things really quickly, but a lot of them sound like great ideas, and I didn't think that necessarily our local Board of Health maybe, might have that educational expertise area, so I was curious if, and doing something great is getting this public health accreditation, if that's going to help the Board of Health, step up again to, what, we have to deal with in our local area, whether it's,
Well, I don't think our local Board of Health is being held back by anything right now, financially or education-wise. 3 out of the 4 public health nurses right now, so myself, I have a master's degree, so 3 of the out of 3 of the public health nurses right now, 2 of them have master's degrees. We have multiple people within the health department who have masters in public health. So nobody's really held back by any degrees. Most of the people within the health department can get money back for advancing their education, because that's something that the city gets. So this is more getting accredited so that we can get grant opportunities or be known within, like it's a unique group of people. But education-wise, it's more like we're part of national organizations already, like NACHO and different organizations, and then I'm part of boards of health organizations or, health officers organizations. So I already belong to those organizations. And we have multiple organizations that the health department belongs to.
okay.
So I don't know what, I could call Corey and ask him what he's talking about, because he didn't ask me, like, who's employed by the health department or if we're being held back. We get calls every day about people wanting to intern or come to Lowell, so because we're the 5th largest city. So I'm not really sure what he's talking about.
So
Yeah, I know
just
that-
generically speaking, whenever anything gets an accreditation, you're going through that process means you're telling the public that you have a higher level of expertise
Right.
in what we're doing.
Yeah.
And in this case, it's more getting recognized for the level of
Right.
expertise you already
Right.
have rather than elevating it.
Right.
That's what it is.
Yeah, I think he was speaking like about, indoor air quality, there's, I mean, it's definitely not my area to say what type of licensing. I was just curious because I am familiar with that accreditation and I thought it was wonderful that you're actually
Yeah.
taking the steps, so thank you.
Yeah, we actually have a lot of the i's dotted and t's crossed in order to get to where we need to be. Yep.
Right, yeah, like I said, I didn't really know how to word it. Yeah, I think that was it. I mean, if I had any other questions, I could, sorry.
Thank you for coming. Have a good night.
All right, thank you.
Thank you.
Thank you so much for your time. Thank you.
The next item on the agenda is the director's report, the update on the DPH viral respiratory illness dashboard. The document was mailed and sent email in the packet. Lisa, did you want to say anything about that?
So DPH rolled out this new respiratory viral illness dashboard. I don't know if anybody had a chance to look at it. It comes out every Thursday. It's updated. It's just like the old COVID dashboard. It's very exciting.
Memories.
It is memories, just like our old days.
I didn't say they were good memories.
Oh, and the city of Lowell is going to start doing COVID wastewater testing again. So I'll have that for the new.
I did have that question.
I knew that you were going to have that question, and I read your mind, so I'm all ready for that question.
I love my COVID wastewater level.
I knew you would, because,
Doing opioid testing too.
and opioid testing as well, that's coming as well. I did find out from the new wastewater person, opioid testing is coming as well. I'm not quite sure what we're going to learn from that, though, because we have so many nursing homes that have people on a hospice, so I'm not sure if those numbers are really going to tell me much. And the hospitals.
It's just more embarrassing time, and not too many people in those are on fentanyl who are actually tested separately for fentanyl, that makes sense.
Right, so I'm not really sure what the numbers are going to tell me on a day-to-day basis, but that's okay.
So do we have a sense that the COVID numbers, though, were up in December?
So we're not, so this Thursday is where it's going to hit us because we have that week lag time behind. So this,
The answer is yes.
Yes.
but yes,
I can tell you the
yes,
answer is yes.
yes,
At one point, Lowell General had 70 employees out with COVID.
yeah.
Put masks back there.
Yeah, we put masks
We
on.
unfortunately don't have a very high COVID vaccination rate currently in the state.
No, we don't have a high COVID vaccination rate.
We will tell the public that they can get
We
a
don't
free
have a high
COVID
COVID
test.
vaccination rate or booster?
Booster,
Booster.
Okay, thank you. Yeah.
booster.
I think it's 18% of adults have received their COVID
Well, I
booster.
think the state was 32%, and flu was 40%.
Was it?
Yeah,
So it's come up a little.
just a tad, yep. I did look at it.
So get a free COVID test.
You can go to covid.gov and get a free COVID test kit if you'd like.
Next item? Let's hear about the accreditation.
Okay, so I did give you the slides for the accreditation, because I did need to educate everybody at the Health Department and the Board of Health about the accreditation. So this is my step one. And there is a slide in here that tells you the steps going forward. So you do have all the steps in here. We are in the readiness checkoff. We have done the CHA, the CHIP. So we are in year one, and we're getting close to the application fee.
What is the application fee?
I'm not sure, but we do have, the state's paying for it, so it's
I
okay.
was going to say, we know that we're going to be able to pay that, so the state's going to.
The state is paying for it, because we do have a consultant helping us, and the state, because there's only 6 health departments right now, 2 of them are doing re-accreditation. Worcester and Cambridge, I believe, are doing re-accreditation. So it's part of something that DPH is, like the state is paying for with a shared service agreement, so.
So on the increased resources, 39% budget, accreditation has had a positive impact on the health department's budget.
budget.
You know that's not happening here, right?
Well,
Unless you get more grant money.
well, we can try and get more grant money. There's some homeless grant money out there. We can try for that. I can try.
Or turn my finger on this.
Yeah, on the back page is our accreditation coordinator and our charge ship coordinator. So those are our people on the back page.
Is there an ask or expectation of the board in this process? Or
Not right now,
Just
no.
educational?
Just educational so that you know what's going on, but there are educational, so along the way, people are supposed to have educational things, like a lot of health directors don't have master's degrees, and then in the public health world, a lot of nurses in different, Drake has a nurse that's an LPN, and they want all nurses to be RNs, and then they want all nurses to be bachelor's degree nurses, but across the board in the state, a lot of nurses aren't RNs or bachelor's degree nurses, but we're ahead of the curve.
Because we have the pay rate for them.
Correct. So, yeah.
Finally. Okay.
I think this is great. I'm glad you guys are doing this, and I support it.
Thank you.
Put that in the right.
It's a lot of work.
Yeah. Okay.
I'm glad the public supports it too.
Anything else in the director's report? I don't know if you want to just mention that, in terms of health around the ICC arrivals.
Oh, ICC.
I think I believe we have 84 people, 20 families, less than 20 school-age children, and they've all been in a previous community, so they've already either had their vaccines evaluated or, I'm sorry, sir, can I help you?
Is this the Conservation Commission?
No.
In the city council chambers, yeah. Yes, so last week, the first group of families came to the ICC. So I believe it was 24 families, so 80-ish people. And then I think it was just about 15 or 16 school-aged children that will still be going to school in Billerica. And then this week, the second group of families will come. And then they say about 20-ish families will come each week until the ICC is full. And most of the families, or nearly all of the families, should be coming from different hotels or places around the state. So I did go to the ICC last week. I did meet with the, I believe it was 3 or 4 site managers that were there. Very lovely. There's nurses on site daily, security 24/7. So Nicole Chauncey, the public health nurse manager, and I went there, introduced ourselves, gave our cards, and we'll go back again. So they've all been established. They all were settled in by the time we got there. So we'll continue to go back.
It's my understanding that many are connected with Lowell Community Health.
This group was connected with Lowell Community Health, and then the ones that are local were connected with Lowell Community Health, and then they'll be integrated in when they come.
Okay. Anything?
And then we have weekly meetings with them. The city has weekly meetings with them, and then the administration has been meeting, daily or every other day as they need it.
Okay. Anything on the public health or school health division reports?
No, so this is the first month you got the school health back, so there'll be a bigger report next month. This is the first month. November was the first month that they had their system up and running again for the full month. I believe it's public health. I think we're 8 TB cases again. Is what we have running, and I believe she gave a tally of TB for, I believe it's quite a few years, right? She
Yeah,
gave you a
she
nice
looked
little
at
grid?
10 years. They haven't changed much. There was a couple things in the chart that I think just in terms of suspects and suspected, I think, it might just be a typo, but.
Okay, we can get it fixed so that it's on
The
the,
school health report had a blank where the words were for, at least on my copy, in the first line where it talks about, it says the school health unit started the 23-24 school year with, and it's blank.
oh,
It might just be,
It wasn't just with full-time open positions?
no, it should be a number there, right?
yeah,
Oh.
I think it was,
And maybe it just wasn't,
was it 2 full-time openings? Yeah. Okay,
anyways,
yeah,
she can just,
okay. We'll fill that in. Okay. And then you have the, there is the flyer here for the vaccines that we're giving out. So we still have the flu vaccine on Tuesdays from 4 to 7. So that's for insurance and uninsured. And then we are giving hepatitis A for uninsured people because there had been down, I believe it was on the Cape, a group of homeless individuals who had had hepatitis A, and they didn't know if it would spread to other groups of homeless individuals, so they're offering hepatitis A to people without insurance right now, but we could get it for people with insurance if this happens to spread a little bit more, but I haven't heard any more about that. So we have been offering insurance for anybody in encampments and things like that. The problem with hepatitis A is that you should use soap and water to get rid of it. It doesn't really go away if you use hand sanitizer. So living in an encampment, that's a little bit of an issue. So they wanted us kind of to push hepatitis A. So today was the first day of a vaccination clinic at LTLC on Middlesex Street. And then we do have COVID vaccine for uninsured.
so it's not too late to get your flu or your COVID vaccine
Never too
booster.
late.
Right.
Thank you.
Thank you.
Anything else? Do we have a motion?
Move to adjourn, motion to adjourn?
Seconded, motion to
Done.
adjourn, seconded,
Sure.
thank you. Thank you, everyone, for coming.